But if you're just an ordinary American that says, hey, my joints are achy and I think it's because I'm getting old, it's not because you're old. It's because you're not eating right. I promise you, I don't care if you're 50, 60, 70, or 80. You don't hurt because you're old. You hurt because you're eating too much sugar.
Well, I want to welcome all of our viewers today. We're starting off a new video series here at Forum Health, and the name of the series is Restoring Health, Unraveling America's Wellness Crisis. So in this series, which is going to be quite a few episodes involving quite a few experts, most of them within Forum Health, we're going to try to educate, motivate, and inspire our viewers of the many aspects as they affect chronic illness in America today. So we're going to be covering both clinical aspects of the problem and also public policy aspects of the problem. And I have to say, we are going to be discussing what I would call some inconvenient truths. In other words, we're going to be talking about some issues without hopefully getting anybody into any trouble that maybe are not going to be popular with all aspects of everybody out there. But we're going to just try to be honest. We're going to try to be truthful and transparent. And as we go through these different episodes, I'm going to encourage everybody to share this content, subscribe to it, invite your family and friends, and also comment and share questions, because we would love in future episodes to be able to address some of you viewers' questions and concerns regarding these issues that are going to be covered. Now, today, it's the very first episode of our series, and I'm really proud and excited to say that Dr. Andrew Petersen, who was one of our forum providers over in North Utah, is going to be joining me. And what we're going to try to cover in today's first episode is just kind of an overview of this problem of healthcare and chronic illness in America, and kind of how we've gotten to where we've gotten today. It's going to be kind of an informal Q&A type of format. We don't want this to be too rigid, but we're basically just going to be trying today to hit some of the highlights, kind of frame up the problem. I'm going to start off by giving you a quick bio about me personally, and then I'm going to have Dr. Petersen introduce himself to you, and then we'll get into the actual questions and answers format of our topic for tonight. So I'm a physician, MD, started off as a board certified otolaryngologist, born and raised in Texas, spent about 20 years in the Army. And then in the 90s, I became frustrated with allopathic traditional ear, nose, and throat. And I ended up switching into what today my practice, I would call it environmental medicine. So it's a branch of functional or holistic or integrative medicine where I focus a lot more on the root causes of how environmental toxins and threats and stress plays a big role in chronic disease. And that's about me. And I'm sure in future episodes, you'll be hearing a little bit more about me personally. But I'm going to let Andrew now tell you a little bit about his background.
Thanks, Wally. First, I actually do want to thank you, Dr. Taylor, because we've both been in Forum Health for a little while, and I'm inspired that you continue to share the message of health as opposed to the message of disease with patients, and that you really are the impetus, the reason that we're doing this. And so thank you for that. I'm excited to be part of it. My story with respect to how I practice in integrative medicine is sort of like yours, and I think a lot of doctors that do what we do had this sort of moment where they said, why aren't we doing better? I actually practice in a really tiny town in the panhandle of Texas, Wellington, Texas. If anybody's heard of Wellington, they're a town of just under 2,000 people. And I was one of two doctors on staff there. And, it's a fun job to be a family doctor in a really tiny town because you know everybody, and you get to, be both their their friend and their doctor and go to the football games with them and the bank and they'd show you their rash at the grocery store and all that sort of stuff. And but it became pretty apparent that what I was doing was managing people's diseases. I wasn't really helping them achieve health. And my partner at the time, Dr. David Hackey, he and I were becoming a little bit disillusioned with the fact that we weren't helping people become healthy. And so we started to look for ways that we could improve our skill set, if you will. And I started to do continuing medical education, and I'd go to a conference and he'd go to a different conference, and we'd come back and share notes. And eventually we discovered both the IFM and A4M and ILADS and some of these organizations that exist to try to help us find what you said or the underlying causes, the underlying mechanisms of disease. And so I've been practicing this, version of integrative functional medicine for the past 14 years now. And it's really been quite rewarding to say, now what I'm interested in isn't what the name of your problem is. It doesn't really matter if we're going to call it rheumatoid arthritis or lupus. What matters is what's going on. What's the physiology? Um, I was born in Germany. The son of an army officer. I lived all over the country growing up, and so sort of had a chameleon's life of trying to fit into all these different places. I went to high school in South Dakota. I live in Utah now. It's great. It's a great place if you like the outdoors. I'm married, have 6 kids. So it's been a very rewarding life for reasons outside of medicine, but medicine has become more enjoyable as I've been able to discover how to help people be healthy.
So, we're going to be talking about this issue of chronic disease and the poor healthcare situation that we're in as Americans. And, everybody's going to really get the understanding that this is a huge problem that's got a lot of different facets to it. But here in the beginning, I'm just going to ask you, Andrew, if you would, just kind of from your own personal perspective, give me a little bit of what you think is the situation of chronic disease in America and how you think it got that way, just kind of from a 30,000-foot view.
Sure, yeah. Well, I mean, I will say that if you look at the CDC's website, 9 of the 10 causes of death, the 10 causes, most common causes of death in the United States are chronic diseases, right? Heart disease, cancer, stroke, Alzheimer's, the only one that's not a chronic disease is accidents, right?
Exactly.
And
In fact, I think I
Briefly
saw
in
that.
22 and 23, COVID made the list, and that's technically not a chronic disease in as much as it killed you, but it's a chronic disease now because long COVID is an entirely different animal and a big problem. So, yeah, I
Exactly.
mean, as far as the size of the problem, well, everything that we die of is a chronic disease. We used to die of things like malaria, right, or pneumonia, and now we've been able to beat back the acute causes of death, and we're dying of these inflammatory conditions. So we just traded one problem for another.
Yeah, I was asking good old Chat GPT a few questions earlier because it's so much easier to get statistics off of that. But I was not too surprised to find that about 90% of illness in America is chronic. And currently, our 2024 healthcare spending is going to be 4.7 trillion, which that's up from just 2 years ago. Well, actually, in 2000, it was 1.37 trillion. So it's gone from 1.37 to 4.7 over 20 years. It's currently about 19% of our total gross national product spending. So just under 20% of all of our spending in America is for healthcare. And if you look at it on a per capita basis, we spend in 2024 $14,578 per person. That's men,
Wow.
women, children. And that compares to just 2 years ago to 13,493. So you can see it's on we're really ramping things up. And at the same time, we don't really have very good outcomes. I mean, you would think we're the highest level of Medicare or health spending in the world per capita. And our outcomes, according to a recent survey, we were ranked 69th in, if you look at the various outcome measures, things like longevity and maternal fetal outcomes and things such as that. So no question, just looking at it from a numbers perspective, it's a big problem.
It goes to show you that money cannot buy health, right? Like we're just spending money like crazy, and yet we're 69th. I mean, how many third world countries would be ranked above us,
Yeah,
right?
quite
Like
a few. I mean, I
huge
did
number,
see on that list
a
that
huge number
Singapore.
of countries that we would consider undeveloped have better outcomes than we have with respect to their health. We should be embarrassed, but we should also take some action and figure out what we're doing wrong.
And that's exactly where this series is going to come in, because we're gonna really do some deep dives into what are the real reasons for this, and what do we need to do about it.
So then, Dr. Taylor, what do you think are the most pressing health issues that are impacting us? What are the things that where should we put our attention?
Yeah, I mean, the list is really, really long. And most of them are things that are there's very much ways that we can change if we pay attention. And you said you can't buy health care, good health care, good outcomes. I would just make a caveat that I think if we spend the dollars wisely, we can go a lot farther. We can do a lot more for a lot less, and we can have much better outcomes than we have now. So I don't
I
think the fact that we spend
absolutely
all
agree.
these dollars and have these bad outcomes has to be cast in concrete. But for it to change, there's going to have to be a lot of things done, a lot of changes. And some of those are public policy. So we'll be talking about that. But one factor that we obviously can't do too much about, and that's just the fact that we're getting older. And that's not just us in America. It's actually happening pretty much throughout the developing world. I mean, if you look at places like China and Japan and Europe, there's many countries where if you look at the demographics, they're getting skewed to the elderly population. And it's because fertility is going down and childbirth is going down. And so that obviously is a big factor you can't do that much about. But there's also a lot of other factors that definitely we need to think about. One of them is just the environment. I mean, we could spend hours talking about environmental degradation, and that is a huge problem, especially from my perspective, kind of calling myself an environmentally induced medical doctor. And in fact, what really drew me to leave ear, nose, and throat was when I was seeing a bunch of people that had all kinds of sinus and dizzy problems and head and neck cancer when I was in Colorado. And a lot of those people had gotten those kind of illnesses from exposure to agricultural chemicals, which we'll probably be
Right.
talking more about. But that's kind of what got me kind of off the track of where I was and onto this track of environmental. But we've got issues of diet and nutrition. And we could talk for hours just on the ways that our food here in America and our nutrition here in America is not where it needs to be by a long shot. We could blame lifestyle and behavior. We can talk about affordability and access to care. We can talk about the fact that for most Americans, we don't have a very holistic approach. I mean, you put it in good terms when you said that you felt like you were just providing sick care, or what some people call Band-Aid care, where we were just slapping another prescription drug on each symptom that our patient complained with. They have 10 symptoms, they get 10 prescriptions. There can be definitely a shift away from just chronic treatment and more to prevention. I think that's huge. Um, we can talk about the way our farmers and ranchers raise our food, and we could focus a little bit more on the agricultural practices with less chemicals and less of an emphasis on the mass production with high yields, and what's turning out to be nutrient poor food. Um, there's an issue of corporate capture, which as we get more into the public policy, we'll talk about the way some of our three-letter agencies have really gotten captured by big business, big food, big pharma.
Yeah.
We can do a lot for changing people's health literacy, and I'm hoping that that's some of the things we're going to do in this series over the next several episodes. But those would be some of the big ones from my perspective.
Well, like I say, I would love to talk about every single one of them with you. Probably you'll talk to lots of doctors within Forum Health about those things, but they're one of the things that comes to mind as you describe that list is that I think we tend to pick one thing on that list and we're like, oh, this is the problem. We just need to address access and affordability, or we just need to address better food, or we just need to address, the chemicals or what, right? And the reality is when we try to narrow it down to one of those problems, we miss the fact that this is really complicated, but it's well, let me rephrase, it's not even that complicated. There's a lot of things, but if we can just pick them off the list, this is solvable, right? If countries, like I'm just guessing because we're 69th, but if countries in sub-Saharan Africa and Eastern Europe have better health outcomes than we do, it's not because they came up with some big elaborate system to figure it out. They just did the right things in all these areas. So I think that's a really, it's a good comprehensive list. And I would just caution not just ourselves, but also the listeners, don't latch onto one of those. We got to solve all of them, and they're all very solvable.
Exactly. And I think sometimes it seems like it's almost like too daunting of a problem. I like to talk about how American healthcare is kind of like a aircraft carrier going through the ocean, and to turn it, it's going to take a lot of tugboats.
Yeah.
So it's a process. And another good analogy is that in some ways we're kind of like frogs in a kettle, and they're slowly cranking up the temperature. And if we don't figure this out pretty quick, we're all going to boil, and we're not even going to notice it. It's going to kind of happen slowly to us. But from your perspective, what can you say you've experienced regarding the financial aspects of chronic illness and how it impacts Americans?
Well, it's a lot more expensive to be sick than it is to be healthy, right? I take care of chronic Lyme disease patients, chronic fatigue patients that have mold illness and infections like Epstein-Barr, and they oftentimes are debilitated and can't go to work, right? The care itself may be expensive, but being sick is more expensive than that. Um, I think, and this would be a lengthy conversation, and we could spend the whole rest of our conversation just about this. We have abdicated our role for our own health to companies called insurance companies. And when things don't work out well for us, we say, oh, that's not covered. Well, that doesn't change the fact that you're still sick and in bed and can't get up. If it's not covered, well, do something about it. You can't fix the insurance problem, right? If I get in a car accident, let's say I get a rock to my windshield and I go get it replaced and they're like, oh, that's not covered. Well, I can either have no windshield or I can pay for it, right? And it's going to be really hard to drive around with no windshield. And so I think people want everything to be covered because that's sort of just the paradigm we live in. And I think we're doing ourselves an enormous disservice by believing that a company that provides a specific list of health benefits is going to cover every health need that we may come across. Just like the auto insurance may not cover my oil changes, and it may not cover, the crack in my windshield unless I bought that particular rider on my auto policy. My insurance may not cover a gastrointestinal test or a mold test. It may not cover it. And I don't really think that the lab developed tests out there that exist, or it's not like some company is trying to scalp people and do a disservice to them. They're offering something that is of value, and they say, hey, it costs us this much to offer it, and we're going to charge this much. And if there's enough patients that do it, capitalism will see that the market finds the right price. Um, but I think that one of the biggest things we did to destroy health in the United States is we started to rely on insurance companies to tell us what things we should do to be healthy. And then
Yeah,
we're just like, well, it's on the
I
list.
think
It's important. I'll do a mammogram, right? They're not covering vegetables, and vegetables would be a lot better for you than a mammogram.
exactly. And I do think if we looked at the whole issue of healthcare reimbursement, especially from the perspective of you and me as holistic or functional doctors, because I'm always, I don't know about you, but I'm always running up against ways that I want to help people that maybe doesn't get directly covered by their insurance policies. And that's the stance of the insurance.
Right.
And in point of fact, we can treat them for a lot less and
Oh,
end
yeah,
up saving them a lot of money rather than to go through the alternative, which is a lot of expensive prescription drugs that seem to get more and more expensive almost by the day as they develop these new drugs, some of them costing in the hundreds, if not $1,000 per dose.
for
Um,
sure.
so there are some real issues with
Well, most of the spending that we see in the United States is in the last year of life. That's sort of so there's Mark Twain said there's lies, damn lies, and statistics, right? So this is it's an accurate statistic, but it's somewhat misleading. Of course, most of the money is spent in the last year of life. That's when people had the biggest injury, right? Like if I was in a car accident and you tried to save my life and it didn't work, well, all the money was spent the 2 days before I died, right? So it's a misleading statistic, but it's also an accurate statistic because spending all this money to, do 3 heart catheterizations and then open heart surgery didn't make a lot of sense. What would have made a lot of sense is for me to have a less inflammatory diet and exercise, and I would have never had the heart surgery,
there you
right?
go.
And so, these statistics can go all sorts of ways. I'll give you an example in my own life of um, the health insurance myth. Before I was employed by Forum Health, I owned my own practice and I didn't have regular corporate insurance. I had one of those Christian health sharing ministries. I think it was called Liberty Health Share. It was fantastic. For a family of 8, I think I paid $560 monthly as my, cost to participate. And my daughter tore her ligament in her knee skiing, and it covered the surgery 100%, just like regular insurance would have. I had to pay for the insurance, or I had to pay for the surgery up front, and then they reimbursed me, but it worked just fine. And it was $560 a month. Well, now I'm insured with Blue Cross, and I pay more than $560 a month for my half, right? So insurance is costing me more than twice as much as a health sharing plan. Well, that's because when I had a health sharing plan, I was being judicious with how much I spent. I was like, you know what? I don't really want to spend $800. Maybe let's don't go to the emergency room for your, left lower quadrant pain. Let's just see if a laxative will help you poop, and maybe it's not appendicitis, right? And sure enough, that worked fine. And so there's so many things that we have wrong financially. I think what maybe is relevant to Forum Health and integrative medicine and people that might be listening to this podcast is um, if we pay for things, if we're willing to say, hey, I'm going to pay for some of the things out of my own pocket, you're going to end up spending less money and you're going to end up having dramatically better health. When patients come to see me, they generally have a regular family doctor that their insurance covers, but that family doctor isn't doing any of the tests that I do, right? They might check a TSH, they might check their cholesterol, but they're not checking all of the cardiac labs and all of the hormone labs and all of the thyroid labs that I'm going to order. And when I get all that information back, then I can give people an actual plan and they're like, oh, now I can be healthy. And so I guarantee the patients that come and see us and pay me cash out of their pocket to be their doctor are going to have lower health costs for their insurance company and they're going to be healthier, right? So, and you know what's interesting is that's true in a lot of things in life. When someone else is paying for something, right? I pay for my kids' clothes, right? Well, they spend a lot more on clothes than I spend on clothes. I have to pay for my clothes and their clothes. Well, they don't care. They're like, oh, I need new shoes, right? I don't buy new shoes half as often as they do because I'm paying for my own shoes. I'm paying for their shoes. They're like, let me have more, right?
Makes you wonder how many new shoes they'd get if they were paying for them, right?
That's right. So we need to get away from the idea that if it's covered by insurance, it's good. And if it's not covered by insurance, it must not be real or good because that's
Definitely.
never been the case.
And the other thing is, talking about most of our patients also having a regular allopathic doctor, usually a primary care doctor. I know that's true for my practice because I'm only a consultant. But these primary doctors, they may or may not even be paying attention to advising their patient on the best eating plan, or even just to stay hydrated, or to talk to them about stress management and lifestyle and getting exercise. Now, some do. I'm not going to say that's uniform, but a lot of times you just don't see the emphasis on preventive care, and you see it going more and more just to, again, treating
Yeah, I
symptoms.
think I can tell you why that is. And it's not because they don't want to, but it's because, and I don't think people realize this either. Um, we have when my patient comes in and pays me directly to take care of them, I now have a fiduciary responsibility to that person. We have a contract and I owe them something. I actually work for my patients. Now, before, I was employed by a hospital in Texas, and I didn't work for my patient. I worked for the hospital. And if the hospital came in and said, "Hey, you know, we're having a little bit of trouble with keeping our hospital open because we need to improve the payer mix. Can you make sure that if, Mrs. Smith isn't feeling so good that you admit her to the hospital so long as she has Medicare or Medicaid?" Well, part of me wanted to say, well, no, I won't. That's not morally appropriate. But part of me wanted to keep my job, right?
There are a
And
lot of perverse incentives
that's right. Doctors
built into
are
the
remiss
system.
to admit this, but if you see a doctor and he takes your insurance, he doesn't work for you. He works for your insurance company. He's going to order the things that your insurance company wants him to order. He's going to avoid ordering things that the insurance company doesn't want him to order. This is a little known fact about insurance. The more tests I order, the next year my contracts are renewed, the less they're going to pay me. The reason they do that is because I am more expensive than my peers to come up with the same diagnosis. And so reimbursement for doctors goes down the more they look for the answer. And so to do the kind of medicine that you and I do, I would be seeing patients that the insurance company would probably reimburse me like $60, maybe 50, because they're like, you have got to be the dumbest doctor we've ever had on our panel because you're ordering 90 things. Why do you need all those things? All the rest of the doctors order one thing. And I would say, well, that's because none of the other doctors get the answer. And they would say, yeah, but the patients keep coming back and it seems to work. Yeah, because they're working for you, they're not working for the patient. And I think that people don't realize that. They don't realize that you may love your doctor, and frankly, your doctor loves you, but you're not his employer. His employer is the insurance company, and he has to do what they want. That's a real problem. That's a problem with American healthcare.
Absolutely. And another way that the way that healthcare is set up right now seems to be perverse is, how when you take your car into the mechanic and he kind of listens to the engine, he says, "Oh, goodness gracious, yeah, your engine needs overhauled. I can do that. It's not a problem. I can do that. Yeah, it's going to be $2,000 overhaul your engine." And you sit back there and you think, well, wait a minute. He's going to be getting the $2,000 to overhaul my engine. What if it doesn't really need to be overhauled? And I used to run up against that a lot too. When you maybe as a surgeon, and we used to have a saying when I was practicing traditionally that if you have a hammer, everything you see is a nail.
That's right. Yeah.
So, like me as an ear, nose, and throat doctor, everybody needed some kind of ears, nose, and throat surgery. That just had to be what they needed. But if they went to see the kidney doctor, maybe what they needed was some sort of kidney treatment. Or if they went to the liver doctor, it was for their liver. So there
Well, and that's a
are a
little
lot of
tricky
perverse
because perverse
incentives.
incentives always exist, right? we always have to check ourselves and say, is this happening, right? I take care of people's hormones. I take care of Lyme disease. I take care of Epstein-Barr. So if somebody comes in and I'm like, well, hold on, don't jump to the fact that they have something that you're a specialist at yet. But there's still that still exists. And so I don't think that by getting rid of insurance, we would get rid of perverse incentives entirely. But it is important that we try to pay attention to the fact that um, if the patient has to see me or someone like me and pay me, I'm going to only continue to have patients if I'm doing a good enough job that they think I want to go back to him, right? Whether I do the surgery or not, right? If every time I take the car to the mechanic, he has to get paid by me, he's not going to be able to dupe enough of us all the time that it'll be an issue, right? If he was getting paid by some outside source, well, then I don't care if he duped me. It's not my money, right? So it's hard to eliminate perverse incentives entirely. How would you see a surgeon and then have another guy do the treatment, right? But um, the person that is being paid should owe something back to the person that's paying. When I see my lawyer or I see my accountant, they do good work. My accountant may say, hey, we've got to do X, Y, or Z thing. And the reason I trust him is because he keeps doing, a good job managing stuff for me. If my lawyer says I'm billing you this many hours for this email, well, it doesn't make me want him to not write the email. It just makes me want him to win. And that's actually my lawyer's a she. As long as she wins, I'm happy. So perverse
Yes, well,
incentives
I
are hard
think
to eliminate.
like you said earlier, you're being fiduciarily responsible for the outcomes of your patient. I think that's really important. And, to basically try to set our healthcare up more in terms of the value that we provide. I mean, if we can move healthcare in America more in that direction, I think we'll get better outcomes and we'll save a lot of money at the same time.
Well, and I've got a question for you, and it sort of actually cuts on both sides of what we're just discussing, because we have countries that have better outcomes that have an entirely socialist system, and we have countries that have better outcomes than us that don't have a socialist system at all. How would you compare other countries' healthcare to our healthcare? And I guess a few things like where are they doing better and where are they doing worse? Because, like we said at the beginning of this, you gave me a long list of issues, and the insurance aspect of this is not the only aspect. It's just one aspect. It's the one that we just talked about for a few minutes. But if you were
Yeah.
to compare other countries to ours, what would you say?
Yeah.
What,
I mean, I think probably the thing that to me is the most glaring thing would be to look at the kind of policies to protect the food supply and protect the environment in a lot of these other countries around the world. Um, there's a lot of countries that have small farms, small family farms, where the farmers have fiduciary responsibility to their clients, to the people that they produce food for. I think there's places where they don't let as many chemicals get into the food supply. I mean, I was just paying a lot of attention here recently to when Senator Ron Johnson held that hearing in Washington. It was Chronic Health Disease in America, a Second Opinion. And he brought in a bunch of experts. Well, one of the experts he brought in was a lady named Vanny Hari, I think was her name, but she was comparing Fruit Loops in the United States to Fruit Loops in Canada. And the list of ingredients in the American brand was like 4 times longer than the ingredients in the Canadian Fruit Loops, which basically just had grain and some color, and well, not even any artificial color. Everything was natural and there weren't a lot of preservatives. So to me, it's really glaring how much our healthcare has suffered and how much the cost of our healthcare has gone up and the frequency of these chronic diseases just because of the way that our environment is and our food is, and this underemphasis on nutrition. Most Western doctors kind of poo-poo the use of vitamins, you know. Uh,
yeah, I actually was one of those Western doctors back. 20 years ago. I would just say to patients, well, you can get all that in your food. You don't need to take a supplement, right? I couldn't be more different from who I was then to who I am now.
Did you
Um,
ever tell your patients that they would just have expensive urine if they took those
oh
vitamins?
yeah, yeah, for sure. Because I heard some of my attending physicians say that in residency, and I'm like, ooh, that's a good line. I'm going to use that, right? So yeah, that's what we were taught.
Yeah.
Yeah.
Yeah. So, I
Well,
mean,
I like
that's
what
an
you have to say
example.
about the food because that's why I think that somebody else paying for your medicine, like as a system where you have universal health care, you paying for your own medicine, a system that has no universal health care and frankly has no insurance system set up. There are countries that you just pay the doctor, there's no insurance, there's no universal health care. Both of those, there are examples of both of those types of countries that have better outcomes than us. So while who the payer is does matter in part of our problem. It's not the whole answer. And I love what you have to say about the food supply because if I'm in a relatively undeveloped country, I'm probably not eating processed foods. Not because they're not delicious, but because they're not available, right? Because I can't afford them,
Mhm.
right? And thank goodness for the
They're not
blessing of being
available.
poor in
Yeah.
that
They
case,
just don't
right?
make
Because if
them.
yeah, if all I can afford is to have, whole grains and beans and meat, a goat that I raised on my own farm, that's what I can afford to eat. Well, guess what? I'm going to be way healthier than an American, right? So
Yeah.
there's
And
that,
speaking,
and then there's countries like France and Belgium who have said, hey, you know what? I actually think it would be good if we don't have a bunch of sick people because we're paying for the care. So let's make it so that you can't spray glyphosate all over the food before you
there
eat
you
it,
go. I mean,
right?
glyphosate, we
And
could
so
talk
it,
for an
it
hour
sort of goes
about
both
that.
ways. You can make an argument for, hey, if we socialize it, then the government will pay attention and put in rules that says don't poison us, right? Because that's what they did in France is they said, hey, you know what? We're paying for the care. Let's make it illegal to poison the patients, right?
Hey, that's a novel idea.
So yeah,
And
and in
you
most
could even
cases,
social,
it's food supply.
even in a social system where the government maybe is in control as the head payer, you
Yeah.
can still focus a lot more on prevention.
That's right. And they do. That's
And
what's
they
good
do.
about it. They do, right? It's almost like we're getting the worst of both worlds instead of the best of both worlds, right?
Exactly. Exactly.
So, which is a
And
shame.
these kinds of incentives, they can be changed. But again, a lot of it depends on public policy.
Yeah.
And you have to look at the lawmakers and what are the influence on the lawmakers, the lobbyists, and the campaign contributors, which are typically the big food and the big business and the big
I
pharma.
think that that's true, but I also don't want any listener to think, well, we're screwed, right? Because a lot of times people feel pretty helpless when it comes to public policy. I sent in my mail-in ballot the day that it came to me here in Utah, so I've already voted. Do I think that my vote
I voted this
outcome
morning. Yeah,
There you go. Yeah.
ran
Do I
down
think
here and
it's going
stood
to
in
affect
line.
the outcome of the election? Not really. I don't, right? Because I'm one voter out of whatever 250 million. If there's 150 million people that vote, will it make a difference? No, I live in Utah. I know who's going to win here in Utah, right? Um, so, but don't be overwhelmed because even though public policy does make a difference, and we probably are not individually going to be able to outlaw spraying Roundup on our wheat, you can still buy organic bread. And if you buy organic wheat, it can't be sprayed with Roundup, right? And if you're not buying organic wheat, you're making a mistake. You're injuring your own health and the health of your children, right? And so, but people don't know. So I'm not trying to make anybody feel bad. If you don't know that, well, now you know. Stop buying bread that's not organic. In my opinion, the very most important thing that you can buy that's organic is your grain because we spray glyphosate on all the wheat almost that's harvested in the United States, the corn and the soy. So if you're using vegetable oil, you're getting glyphosate. If you're eating anything with corn, you're getting glyphosate. If you're eating anything with wheat, you're getting glyphosate. Well, glyphosate will kill the bacteria that live in your gut and you will be sicker. So, right, while we do want public policy to change and we want to say, hey, let's stop desiccating wheat. I know it's better for the yields of wheat, but let's just charge slightly more for wheat and our yields can go down. It's okay. The farmers won't go broke. They just need to raise their prices. We would be healthier. Right now, $1 out of every five is spent on healthcare. maybe if we could recoup half of that, we could spend more money on food.
I'm old enough to remember when Dwight Eisenhower was leaving the White House. This was way long time ago. But one of the last speeches that he ever gave before he turned the reins over to John Kennedy was he was talking about the so-called military industrial complex.
Yep.
And what he said, and of course he had been the head of our army in World War II, of course, and pretty much saved us from what we were going through in those days. But he said, look, you guys are going to have to wake up, because what we're seeing is there's this affiliation between the government and these arms manufacturers, the guys that build the bombs and the planes and the tanks. And if we're not careful, those guys are going to get control over the government. And then we're going to basically lose a lot of our freedom as Americans to say that. And it's going to lead to things like forever wars and, all that sort of thing. So that, I think everybody locked into that. And we've been sort of fighting that ever since he said that. A lot of people refer back to that. But the
Yeah,
thing
no, I
is,
wasn't alive at the time when he said it, but I'm very familiar with it. And the fill in the blank industrial complex, as far as I am aware, he was the one that coined that term. And the military industrial complex was the first and most frightening and still the most powerful to this day. It's the most powerful. But we also have, other industrial
medical,
complexes, the medical industrial complex, the insurance industrial complex, right?
the
And
big food industrial
yeah,
complex.
you've got big food and big pharma. And the reason we're so sick, the reason we have so much chronic illness is because we're poisoning ourselves. If we weren't poisoning ourselves, we wouldn't be this sick. Now, we have totally gotten rid of, not totally, we have largely gotten rid of a lot of problems, right? We're not seeing Americans die of malaria. And when we were building the Panama Canal, that was the number one killer of the people digging the canal, right? We don't have Americans dying of dysentery anymore, right? Fantastic. We don't have such high child mortality, right? That's great. But we solved most of those problems with hygiene and nutrition, right? People want to give credit to vaccines, but the reality is hygiene and nutrition solve most of those problems. And antibiotics are fantastic, and they help you after you have some surgical wound. But I think we became pretty attached to the idea that our country is better than other countries, and so let's just keep doing things the way we're doing them. And the way we're doing them is corporate. We live in a corporate society.
Yeah.
Um,
Let's kind of change gears just a little bit and talk a little bit about some things people can do to try to improve their health care and the health care of their families and change this tide of chronic disease. What comes to mind to you first, Andrew?
Yeah, I mean, we've said it a bunch of times already, but the very most important thing you can do is eat the right food. And I used to poo-poo the idea of eating organic. I remember that the term sort of came out when I was in college, and I'm like, well, if it's food, it has to be organic. It's carbon based. Um, but I don't know. They just didn't come up with a better term for it. But if you eat something that has been sprayed with a pesticide or a herbicide, it's probably not going to be as good for you as if instead maybe the apple was a little blemished or the peach is a little bruised, right? So I think that's the easiest first step to take. It's not the most important, but it's the easiest is eat organic. The most important is don't eat processed foods, right? If we take apart a food into its component parts, you take the fat and the carbohydrate and the protein and you separate them. And then we mix them back however we like. That's not the way our body was ever intended to digest these foods. And so most of our chronic illnesses, heart disease and dementia and strokes, these are inflammatory diseases. And the number one driver of that inflammation is processed foods. I think the jury is definitely out. We know the answer. It's processed foods that are creating the majority of our illnesses. There's other things that matter, but they're way down the ladder. So if you have a chronic illness, okay, you got to go digging deeper. You need to look for toxins. You need to look for infections. You need to look at stress and the autonomic nervous system. But if you're just an ordinary American that says, hey, my joints are achy and I think it's because I'm getting old, it's not because you're old. it's because you're not eating right. I promise you, I don't care if you're 50, 60, 70, or 80. You don't hurt because you're old. You hurt because you're eating too much sugar.
And it's amazing in my practice how much improvement I can see in my patients just by getting them to drink more water and eat healthy food. It
Yeah.
never ceases to amaze me. So it's always the first thing. And I always tell my patients, if you go back 1,000 years, if people couldn't get better from illness by changing their diet or eating right, they probably weren't going to get well because there were no vitamins, there were no medicines and prescriptions. But you mentioned about autonomic nervous system. I think another thing that we probably ought to point out to our viewers is how much change we can see from learning to avoid and manage stress in our lives. What's
Yeah.
been your experience there, Andrew?
Oh yeah, that's phenomenally important. So I like to explain the autonomic system to patients so that this makes sense because I think a lot of people know, you know, so and so had a heart attack because they were under stress, or my aunt got shingles because she was under stress. And so we hear stress and we're like, yeah, that must matter, but we don't understand what's going on physiologically. And so if you don't mind, I'm going to explain as basically as I can how this autonomic nervous system works. Now you've got your the nervous system that you're in charge of, right? I get to decide whether I move. I get to decide whether I talk or whether I pay attention. That's all within my control. But then there's this other side of my nervous system that's outside of my control. And my heart rate, what temperature I keep my body, whether I'm sweating, whether my immune system upregulates or downregulates, that's all outside of my control. That's autonomic, right?
And
And
I sometimes say they probably misnamed it. It should have been called automatic.
yeah, that's right, because it's going to happen, right? Now, it starts in your gut. 1% of all your nerves are in your gut lining. They're called enteric nerves. And the enteric nerves are simply sending a message to the brain by way of the vagal nerve to tell you whether you're in danger or you're safe. And that's all they do. They just determine, am I safe or in danger? And then they send the message. The brain does not debate the message that it gets. It doesn't say, well, I know it says I'm in danger, but I feel pretty safe. We're going to be fine. No, the brain doesn't debate it. It just sends the message down through the parasympathetic or sympathetic chain. Sympathetic nerves turn on, you're in fight or flight. Parasympathetic nerves turn on, you're in rest, recover, digest, repair. So if you're in fight or flight, the sympathetic nerves turn on, heart rate goes up, blood pressure goes up, immune system kicks into high gear, you get sweaty, you get hot, your hair stands on end, all the blood goes to your muscles, and now you can escape from the danger, right? Well, maybe the danger is that you have a paper due tomorrow. Maybe the danger is your boss yelled at you. Maybe the danger is that you've got,
You're about to
your
overdraw your
anger.
bank account.
Yeah, right. And so your immune system is in high gear and your heart rate's going up and your blood pressure's going up. And the danger was that you're trying to, get along better with your kids and your wife, right? So stress is enormous. Now, what happens if the autonomic nervous system tells you to go into rest, recover, digest, repair? Well, the message from your gut goes to your brain, tells you to do these things. Now, heart rate goes down, blood pressure goes down, immune system calms down, blood goes to your stomach to digest things. Now you can repair your body. We are the only animals that spend this inordinate amount of time in fight or flight. I like to use this example with my patients. A zebra lives on the savannah, right? Gets chased by a lion. Well, it runs for its life. It is in the immediate jaws of death if it doesn't escape. But somehow it escapes, it gets back in with the other zebras. It doesn't stay in fight or flight for the next hour or 2 hours or 6 hours. It doesn't write to its congressman about lions. It doesn't post it on Facebook. It doesn't tell its neighbor, hey, those lions are a problem. It just goes right back into parasympathetic rest, recover, digest, repair. It starts munching on grass. And ironically, it can still see the lion up on the hill. And yet it's okay. It's back into rest and recover, right? We don't do that. We get stuck in this fight or flight thing. I actually think it's because we are a different, more noble creature, and we realize we're going to die, and we realize we are fallen, and that we need grace to change. But that's a whole different conversation. But we're stuck in fight or flight, And now all of these health problems occur, right? And so it's funny, in the United States, we've listed a whole bunch of problems that probably are going to make our listeners go back more into fight or flight. Um, and that's a shame because we also happen to live in a place where we have plenty of food, right? And it's not hard to communicate with our loved ones, and we have shelter, right? All of our basic needs are pretty well taken care of. It's not hard to get all those things taken care of. So in a weird way, we're about as safe as we could be, and we feel in as much distress as we could be. So that
Can
doesn't
I
answer your
can
question. That
I
just
can I just
tells.
throw in a couple of other things
Sure.
that I've learned about this whole issue of the vagus nerve and all these danger signals that come up to our body, many of them from our gut.
Yeah.
One of them, I've learned a lot about what they're calling now the mitochondrial cell danger response.
Yeah, yeah, the cell danger response.
And
Bob Navigo, if you want to read
that's
about it.
been huge in my practice ever since I learned about it now about 10 years ago. And it's not new. It actually goes, they actually can trace it back even to primitive creatures like the animals that we've talked about, and even much more primitive. But in a nutshell, what it means is that when your brain perceives that you're not safe, and like you were saying, it's pretty much a black or white thing, that when it perceives danger or that you're not safe, one of the things that happens is that there's this innate evolved connection between the threat brain and the function of our mitochondria. And it evolved because it gave benefits. That's the reason we do it. But basically, what happens is that our mitochondria go into a shift that's very reversible, and very can happen very quickly. But basically, what happens is the mitochondria shift their metabolism away from aerobic, mostly fat metabolism, over to anaerobic metabolism. And a couple things happen. First of all, our amount of ATP goes down pretty dramatically. So without ATP, that pretty much explains all the fatigue and all the intolerance of exercise and exertion that we see. And then also, when we're in this altered anaerobic metabolism, we tend to get acidic, primarily from lactic acid. And when our bodies are acidic, because the pH is off, our enzyme systems don't work the way they ideally would if we weren't acidic. So that's a couple things. And I always tell my patients, if you can learn to be calm and tranquil, that mitochondrial cell danger response goes away, and often quickly. So
Yeah.
that's one of the big things I would say. The other thing about this fight or flight and being in the sympathetic danger response is that, yes, to get away from it, it's good. It's a good idea to remove whatever the factors are that are triggering it. That's clearly important, whether it's mold or whether it's having an overdrawn checkbook or what have you. But it's also a good idea to know that if we learn the principles of self-calming and we practice those on a regular basis, and whether it's praying or meditating or learning to breathe or going for a walk in the park, there's all kind of things you can do. But at least in my practice, I found that to be huge,
Oh,
to
yeah.
actually see the signs and symptoms of chronic illness reverse. So I just want to throw those
Absolutely.
two things in there too.
Yeah, for sure. And those practical things that people can do. I'm a churchgoer, and those simple things, you often call them the Sunday school answers, right? But those Sunday school answers are generally the right answer. And it's so funny. We want some big fancy answer, right? Oh, what can I do? Oh, here's a machine. Well, no, you can breathe, you can meditate, you can go for a walk, go on a hike, go sit in the sunshine. All of those things will make an enormous difference. There was a movie from years ago, I think it was called 7 Years in Tibet. And Brad Pitt goes and, has this sort of rejuvenating, like, I've got to get my life right. I have a patient who he was probably the sickest Lyme patient that I've ever taken care of. And treatments, I mean, I can't even go into the level of depth with the treatment. He was the sickest, and I see a lot of Lyme patients, and they'll all wonder, was that me? Well, it probably wasn't you. This guy was near death for, I want to say, 7 years. he got a divorce. He talked to a counselor and did ketamine assisted psychotherapy for some abuse that had happened when he was a child. He sort of rebelled against all of the medical stuff that we were doing and said, I'm done. And 2 years after that, he came back off sort of this I quit. I'm not gonna, and he didn't say I'm gonna be healthy. He just said, if I'm gonna feel this bad, I might as well be dead. So I'm not gonna do anything. And somehow he just let go of all of this stuff. And he's now healthy. I actually just did a test on him. Um, it came back this week, and he does have some antibodies still, but they are lower than they have ever been. And I don't think I can take credit for it. I don't think it was because of the treatment we did. I think it was because his autonomic nervous system finally calmed down. All these stresses that he had been through, this abuse as a kid, this all the stress of being all this stuff, and now that he
But
was
I'm sure
able
you
to,
helped him know that that was important.
oh yeah, yeah,
And
yeah,
that's
yeah,
probably really was huge what
yeah.
you did
But
for him
that's the
that
thing that
way.
cured him. What cured him was letting his autonomic service nervous system calm down, his cell danger response improve, his mitochondria turn on, and now he has energy. And he actually has a job for the first time in 10 years,
Wow.
right? It's amazing to see this guy. I love him just as a person to see, wow, somebody could do it. You could come back from the edge of hell and and become healthy again. And I will say too, and I'm not trying to be overly modest. I think patients do 95% of the work, and doctors give 5% of the effort and advice, right? And I cared about him a lot, and I did a lot of things that I think made a difference. But between him and me, who had to do all the heavy lifting, it was mostly him. And thank goodness that he did it because that means he got better. Um, so if that's not happening in your life, if you're listening to this, you're like, I'm still not better. Well, don't beat yourself up. That will just make it worse, right? But do those simple things that Dr. Taylor just said, right? Learn how to do square breathing. You breathe in for 4 seconds, you hold it for 4 seconds, breathe out for 4 seconds, you hold it out for 4 seconds, right? Um, eh, Pray, uh, have develop some relationship with God. I believe He's real and He loves us. Meditate. If you're not ready to, you know, if you're still mad at God because you're sick, well, then meditate. Look at the world. It's beautiful, right? Go take a hike. You'll find peace. And as soon as you have some sense of peace, you'll be able to say, okay, actually, I'm not in danger. And there's more to it than that,
Maybe a
right?
little
Like,
less time on X and Facebook.
yeah, yeah. I actually had a conversation with a patient today, and she and I have the same addiction. Hers is TikTok, mine is YouTube Shorts. And I struggle with this addiction. I probably once a month, I'm like, why am I awake? It's 12:30 at night. Why am I still, swiping up? This is stupid, right? And then I'm like, okay, I gotta beat this. So I'm gonna put my phone outside the room and I'll have my wife set an alarm on her phone, right? We all have our little hangups. But I guarantee you, I am not as healthy when I'm paying too much attention to social media, right? So the other things, just to answer your question, because I love talking to you. We could talk all day, and I think people are bored of listening. But um, Vital Side is one that you turned me on to. Vital Side is a great way for people to learn how to calm themselves down. Vagal nerve stimulation, whether you use Alpha Stim, Dolphin vagal nerve stimulator, those things work. Um, Ketamine assisted psychotherapy. If you've had trauma, even if you don't think it's that big of a trauma, right? Because people are like, well, some trauma counts. If you were sexually abused or if you were off at war, everybody's like, oh yeah, that one's trauma. Well, what if you were the kid that didn't have a lot of friends, never felt accepted? What if you
You're
were
the
the kid,
last one picked in the
yeah,
football game.
always got picked last, right?
Yeah.
That we don't really want to call that trauma, but it is
Yeah.
because you don't feel safe. How could you possibly feel safe if your peers didn't want you around, right?
Yeah.
So neglect is as much a trauma as sexual abuse. And I'm
Exactly.
not saying that to try and downgrade sexual abuse, but trauma is a big deal. And if we somehow a long time ago separated psychology and medicine, and we should never have done that because they are inseparable. Your mind and
Well,
body
I'm glad
cannot.
you said that. I'm glad
What's
you said
that?
that. I think that's one of the worst things we've done in medicine is we've
Yeah,
made psychiatric disease seem like a whole different set of problems
yeah,
than whether it be aches and pains or headaches or gut problems. It's not. It's just those problems as it affects our mood and affect is all
yeah,
it really is.
yeah. I love to read. One of my favorite books is When the Body Says No by Gabor Mate. Great book. He's a physician out of Canada. We don't agree on everything, but boy, this guy has hit the nail on the head when it comes to the body and psychology, psychiatry, medicine, how they cannot be separated. You can't separate your mind from your body. So why would we try to do that in medicine? So ketamine assisted psychotherapy has helped an enormous group of my patients that otherwise wouldn't get better, right? And the last thing I would say with respect to your question about the autonomic nervous system is a thing that I've started using recently. I don't do this procedure, but I found it very useful for many of my patients. It's called a stellate ganglion block. Have you ever
Mm.
used that before?
I used to, not so much lately.
Okay. Yeah. For my patients that seems like nothing, and this is really good for my mast cell patients, my MCAS, they just everything they do, they can't make progress, right? I try to detoxify their mold, they get worse. I try to treat their Lyme, they get worse. We try to give them some herbs for their Epstein-Barr, they get worse. Everything we do makes them worse, right? Well, a stellate ganglion block seems to right now be a thing that I'm able to now have this window of opportunity to make some progress.
Well,
Because
how do you get at it? Where do you how do you inject that?
Well, so I don't do the procedure. You send them, I send them to an anesthesiologist. It's just an injection here in the neck. It's ultrasound guided. The stellate ganglion sits sort of between the two branches of your carotid. And so they put an ultrasound on there. They find that bundle of nerves. Basically, you've got this bundle of nerves that comes together and then spreads back out. And if you can numb them right there, now you've blocked their sympathetic overdrive. And so they're not in fight or
I
flight.
was going to say, I bet that breaks that brain response that we've been
Yeah,
talking
exactly.
about.
And you know, I've seen this procedure done, and the patient who, the anesthesiologist came to my office and said, "Hey, I brought a patient so you can see exactly what we're doing," and he said, "Here's what's going to happen. I'm going to ultrasound. I'm going to inject it, and this patient is going to cry or laugh for the next 20 minutes,
Hmm,
and then after that, they're going to feel much better. And how long this will last is hard to say. Could be 2 weeks, could be 6 months."
hmm.
And I don't think the anesthesiologist necessarily knew the reason why. I believe the reason why is if you have already gotten rid of most of the actual threat, it's going to last a long time. But if the threats are all still there, say your checking account is still overdrawn and you still have Lyme disease
Or you
and
still live in a
still
moldy environment.
are in a moldy environment, the threats are all still there, right? And so maybe the benefit only lasts for 2 weeks because your body can't be tricked that
You're
long.
going to keep getting the same
That's right.
incentives
It
of
goes back
danger.
into fight or flight.
Yeah,
But
signals of danger.
during those 2 months or 2 weeks, I can make meaningful progress. Now I can start to get rid of the threats. Where before, every time I tried to change or shift the threat, the body was too scared to have anything change.
Well, and
Because
the other
one of the
thing
most
I
scary
would
things that
say,
happens is change.
the other thing I would say is probably huge about that is you also give the patient an opportunity to see what it could be like to
Yeah,
be better. And and
absolutely. Yeah,
and
no,
I
that's
find
so
that
true.
that's huge. Whether it's just reassuring the patient that you've seen people get over what they've got, or you send them to somebody like Lindsay who did the vital side program we talk about, yeah, or a stellate ganglion block, then at least people know, okay, that's what it looks like for me to be well again. I can do that.
Yeah. So those are my four things in sort of broad categories, but stellate ganglion, ketamine-assisted psychotherapy, vagal nerve stimulation, and things like vital side, which I think should include everything from breathing to going on a walk. The one other thing that I didn't mention that I do like for your autonomic nervous system is called brain tap. Brain tap is essentially hypnotherapy. And for people that can't sleep or have anxiety or have chronic pain, it can be really, really valuable. I love that device. I have one in my house for my senior in high school who's not a great sleeper and she really benefits from it. So
Interesting. Yeah. I use something similar. But yeah, there's brain tap is a good one. Why don't we shift gears for just a minute and talk a little bit about something else people can do? Uh, not only to get themselves better, but even their families and even their community. And that's becoming more health literate.
Yeah, they're probably, if they're watching this, then they're already doing that. They're becoming
Well,
more healthy, right?
exactly. I mean, that's the first thing I would tell them. As it's great that you're watching us, and it's great that hopefully you'll share this with friends and family. But
Yeah.
I think that there is so much to be said for people that are informed, and I think that that's going to go a long way to changing our chronic health situation that we're in now.
Yeah, I actually think that that's what changed the experience for me. We live at an amazing time, and this is probably true in most time periods, but Charles Dickens said it was the best of times, it was the worst of times, right? That's usually the case. We have some things that are amazing and some things that are hard. Well, we happen to live in what we call the information age. And what a wonderful time to be alive, right? You can have all the information. The hard part is assimilating the information, being able to, filter out the not accurate stuff from the true stuff. But you can go on the internet and discover more stuff about your health than doctors knew about your health even 30 years ago, right? We now
Exactly.
collectively have more information and more accurate information than we've ever had in the history of mankind, as far as we know. I'm pretty sure the reason that I'm an integrative doctor is because there was a patient, Holly Johnson, in Wellington, Texas, who came to my office and said, Dr. Petersen, these are my symptoms. Will you tell me what to do? And I said, well, I don't know. And she said, well, then will you read this article? And then will you help me do this? Right? She was the nicest lady in the world. And she helped me learn. Well, the
Don't you
only
just
reason
love
that
it?
she knew is because she had gone on the internet and learned, right? And so the more informed you are, probably you could find a doctor that's willing to listen to you. You don't have to go to Austin, Texas or Provo, Utah to see either me or Dr. Taylor. You could find a doctor right where you live and say, hey, will you read this? Because I think this is what's wrong with me. And I don't think doctors went into medical school to work for an insurance company. They really do love you and want to work for you. And if they have a moment of time, they're going to say, oh, yeah, I don't know what to do for you. I will read that, right? It doesn't always work because sometimes they're really busy. But that's what happened to me. That's what changed me. And that's when I said, wait a minute, I actually don't think I'm treating the problem. I think I'm just managing the disease. And she was
Yeah.
patient with me and
Yeah.
she was nice to me. And that so
Two things.
being
I
in
want to say two things to follow up on that. First of all, I've been doing this. I'm almost sad to say, coming up on 50 years, and I've been doing it from a holistic standpoint for over half of that time. So probably about 30 years, 25 to 30 years. I continue. A week doesn't go by that I don't learn something significant from one of my patients,
yeah, from our patients.
from our
That's right.
patients, because they're well read, they're curious, that they want to be self-aware, or for their families. And so, yeah, that's the first thing I would say, that I never would ever say that my patients don't have a part of my ongoing education as a good provider. And so I think you almost can't learn too much. Although I would say that you do have to be careful, because sometimes I have seen people read about things and assume the worst. And doctors are really notorious for that. You know, they read an article about some weird disease and they've got it, you know.
Sure,
Uh,
yeah. Yeah. And
but
like the medical
I think that's an
scenario.
exception to the rule. For the most part, being self-aware and spending the time to educate yourself is very valuable.
Absolutely. I would say this, doctors are people too. They're actually probably not that much smarter than you are with respect to our IQs. They were good at memorizing stuff. That's how come we made it through medical school. But as a general rule, they went into medicine because they cared about people and liked people. And so we do become jaded. I saw myself becoming jaded in this little town because, ER visits at 3 a.m. for silly things. They were silly to me, right? They might not have been as silly to the patient. Um, and I had to sort of check that hubris and arrogance and say, wait, the patient thinks it's important. But by and large, your doctor wants the best for you. And so they'll usually listen if you're kind and don't make them feel insecure. I think that's the reason why doctors dismiss things is because we're supposed to, we have this uh, aura or this, what's the word? Reputation for knowing everything. And so when it's clear to someone that we don't know everything, it's like the Wizard of Oz. You're peeking behind the curtain and you're saying, "Wait a minute, you're just an ordinary guy," right? And that's hard on doctors because we're trying to make sure that that reputation, because with the reputation of knowing stuff comes the results of people doing the things we recommend, right? So we don't want to lose your confidence. And so doctors oftentimes will dismiss things and I don't think they're conscious of this, in order to maintain that reputation and therefore have that level of respect, not respect like, oh, I really like you, but respect like, oh, I made this recommendation. I think it'd be good for you to do, and I want the best for you, so do it, right? Um, and so I think the insecurity of doctors is usually played out in, I'm not going to read that because it can't be true. If we were more confident in what we do know and comfortable with the fact that we don't know everything, well, then we would just read stuff and we'd be like, oh, that's interesting. I didn't know that. Right. And I don't know, maybe there's things that I've said today in this very thing that some of our listeners could comment and say, that wasn't quite accurate. Here's the proof. I should have the interest in being better and learning to say, oh, I guess I was inaccurate with that thing that I said. It was a fact. I wasn't quite right, right? That should be the case for all of us as humans, is we're just trying to always be a better version of yesterday's person. So,
I was just
individually as patients, there are so many books that would be fantastic to read, right? I like Ben Bickman's book, Why We Get Sick. Um, that would be a good place to start with respect to foods. What is it called? Good Energy by Casey Mears. Haven't read it yet, but I guarantee from listening to her, it's going to be a good book. There's books on gut health. I honestly think if you're not reading at least one book on health every year, you're not trying hard enough.
And
So,
you know what I can suggest? I don't know if people have time when they're kind of semi-idle or driving, that sort of thing. I've gotten a lot out of audiobook.
oh yeah, that's how I listen to one book every 2 weeks on average,
Yeah,
and it's all on Audible.
yeah. So I mean, Audible is awesome. I listen to a lot of political science stuff because I'm so interested in public policy. But I also listen to a lot of clinical stuff as well. In fact, I
Yeah.
was just going to say, I want to mention the whole issue of confidence on the part of the public. But I was listening to a short video right before you and I jumped on the call, and a guy was talking about a Gallup poll on people's trust in industry. And they had just come out with some figures for the pharmaceutical industry. And they said 18%, only 18% of Americans had a positive feeling about pharmacy, the pharmaceutical companies. 60% had a negative attitude. And I think the figures for healthcare providers is not a whole lot different than that. And of
Yeah.
course, I
And
think the figures for lawyers is maybe even worse yet. But at least thinking about doctors, which is what we are, of course, I think that's where these situations, like you were kind of mentioning, of doctors that don't want to admit that they have anything to learn or that they aren't the ultimate authority on things. It's their way or the highway. I think that's done a lot to make the public maybe not be so confident in healthcare in America. And I think it's also affected outcomes.
oh, it has for sure.
I've
Back before
seen
the
it.
information age, doctors were the most trusted professional in the country. And I think the reason that that was the case is because patients couldn't fact check us,
There you
right?
go.
So they believed us. Now they can go online and read and they can say, wait, there's conflicting data here. So why are you so dogmatic about your opinion, right? Most things, there are conflicting data. There are very few things in life where the absolute answers are just right there, and there's nothing that points to the other direction, right? Um, I don't know. You could give me any example, and you could say, well, I don't know, the speed limit or the reality of God or whatever thing. You could say, okay, what's the data show? And it's conflicting. So how can anyone, if there's always going to be sort of two sides to every argument, how can someone be so dogmatic? We should be open-minded to say, well, this is what I understand based on the knowledge that I have and based on my experience. And so this is what I recommend. But I'm certainly open to the idea that I'm wrong. And if you have something to offer to say, hey, what about this, doc? I should certainly be willing to look at it and say, hey, that's a good point. I hadn't thought of that.
Well, you know
Right?
what you've just said about there's always pluses and minuses to different things, and you've got to try to find the truth. I think that begs the question about that we should have always an opportunity to have a dialogue about everything.
Yeah.
And I think it's very dangerous when we start being led to believe that there's only one truth
Right.
and
Yeah.
we can't consider an alternative. I think we've seen a lot of that in the COVID pandemic.
Yep. For
And I
sure.
think we've seen a lot of that relative to the vaccination debate that we're seeing
Absolutely.
right now. And those are just a couple of glaring examples. But, you know, for me, I agree with you completely that we've got to have that ability to access information, whether it's right or wrong, and then we have to learn to be able to decipher.
Yeah, the greatest when I was somewhat critical of this great country that we live in. The greatest freedom that we have is freedom of information, right? And freedom of speech is how freedom of information exists. And what I say might not be true, but you should, by all means, defend my ability to say it so that just in case it is true, you could hear it. No one's making anybody listen to anything, and so we
Or
we
believe it.
yeah, or believe it. And so we've got this real bad disease right now of labeling things misinformation. We need to exterminate that from our lexicon because it implies that we already know what the truth is. We don't already know what the truth is. 9 times out of 10, it is not black and white. It is gray. Now, it could be a really dark shade or a really light shade of gray, but there are very few things that we absolutely understand. I was fascinated by an example of gravity. We all accepted gravity and what it was. I think this was in Brian Greene's book on what's it called? The Elegant Universe. We just were like, okay, gravity's true. What is it? Well, it's the Earth pulling things towards it. And well, Einstein said, well, no, I'm not exactly sure that it's the Earth pulling things towards it. I think what happened was the Earth pushed space out of the way, and space is pushing back. And gravity is actually space pushing back, not the Earth pulling down. And so, was gravity true? Yeah, it was true. Was our understanding of it accurate? Not exactly. And is that description that Einstein gives of the Earth pushing the fabric of space out of the way, is that exactly? Maybe in 5 years we'll learn more about that. But so even things that are officially accepted as always true, maybe we could still understand them better, right? And so that's my, I guess, big point of absolute truths is even when they're absolute truths, maybe we still don't understand them well enough. So when you find something new about it, now it changes your perspective. I think that for healthcare, that's happened over and over. I like to give the benefit of the doubt to most humans because I think people are generally good, right? And so when somebody said, "Hey, don't eat eggs because they're bad for you," I bet they weren't trying to somehow undermine the egg industry. That's probably what they believed was true, right? And then the next guy said, "No, no, no, eat eggs. They're good for you." Well, he was probably saying what he thought was true too,
Yeah.
right? And we learn more and we learn more, and hopefully in 10 years we look back at this conversation and we're like, oh, look at all the things we got wrong, as opposed to we're still stuck where we are. So,
No, that what you said about misinformation and disinformation, I mean, those are fairly new terms. I mean,
yeah,
we didn't say that 10 years ago. But to me, what it means is that what something is labeled misinformation or disinformation just means is that I believe this and I want you to believe this. So what I'm going to do is label anything that's not consistent with my belief misinformation or disinformation. And there's just no place for that,
Yeah.
you know.
It would be a lot more productive to just say, I disagree, right? Um, uh, just to say, hey, you said such and such thing, and I have a different opinion.
Yeah. Let's agree to disagree.
Right. Or we can just disagree. We don't even have to agree about the disagreement, but you
Just
know,
disagree.
and they want it to be based on, well, this is a fact. Okay, well, a good example is the Holocaust, right? And Holocaust deniers. Well, that is a fact. But all of the details about what happened, you look at the movie Schindler's List, and these people that went out of their way to be heroes, morally good heroes, but they were on the wrong side of the war with respect to what they were doing. It was a munitions factory. They were making bullets to kill people that were trying to stop this outrage, right? But simultaneously, he was making sure that any of the Jewish employees that he had were saved from Auschwitz, right? It's not that black and white. So whenever we label things that we think are black and white misinformation, we're just doing a disservice to true human knowledge and understanding. So
Yeah. So, as we start to kind of wind things up, I think it's been a really good conversation. I've certainly enjoyed talking to you. And just to remind people again that this is a series, this is just our first episode. We're going to be doing interviews with other providers. I probably won't be hosting all of them. Who knows? Maybe Dr. Petersen might even be a host a few times. But we'll be delving into a lot of these topics in more detail. Maybe on some of them, we'll mostly just be, focusing in on one small aspect of some of the things that we talked about, kind of in the high points today. But definitely keep your eyes out for it. We'd love to have you. And again, we'd love to hear your questions and your comments and your feedback. Was this helpful? Was this hurtful? What can we do to make it better for you, our viewers? And I'm just going to stop and say, Andrew, do you have any parting thoughts or ideas that you maybe want to finish up with?
sure, you bet. Well, first, thanks for being the brainchild behind this. We've been all over the map today, and I think only a limited amount on uh, what I think patients would think of as the nuts and bolts of their health, right? And that's sort of where you have to start with a series like this, is with a really big picture. And so I guess I would say to our listeners, please don't be discouraged or think, oh, well, it's always going to be a political discussion from two guys that have opinions that I disagree with. I have patients of all different perspectives. And when it comes to your health, I guarantee you that Dr. Taylor cares about you getting all the way healthy. And you might disagree on some policy, but don't let that interfere with your ability to say, how do I become healthy? Right. So that's one thought. Another thought is that just sort of a health nugget. Um, there's there's the aspect that you want to get better, and that's your body healing. There's the aspect that you don't want to get sicker. That's your body falling apart. And I want to talk to you again about those things and let patients start to understand the fundamentals of how they can be healthy beyond the things that we talked about today, which mostly what we focused on with respect to their health, I think, is the foods you eat need to be whole foods without toxins, and you need to avoid other toxins in the environment and stress, right? Those are sort of the three big health takeaways that we talked about today. But I promise you, if you'll come back and listen, we'll go into extreme detail in each of those things. So, um,
Yeah, I know that you gave us a talk not long ago at the provider level and forum, and you shared a lot of those ideas. And I look forward to getting you back on and hopefully having you share more of those with our audience in the future.
yeah, and I've loved this conversation. I think you and I could enjoy talking together for hours on end, and if someone wants to listen in, they're certainly welcome to. I honestly, at times, I try to temper my enthusiasm and try to stay more in the middle. But I've really enjoyed visiting with you about these because I think these are important things. I think that these policy discussions matter. I like listening to people like I don't know, Joe Rogan about policy. I also like listening to Dave Asprey about some of these real deep details about health. And But you can't get into deep details about health without some higher level of saying, hey, what's going on? How could we be better as a country and as
And
individuals?
I know that you and I are both pretty much in the same place as some of our theological beliefs and things. And I think both of us would just know that our Creator wants us to be well, wants us
Yeah.
to be whole, wants us to be fully functional. And I know that that's possible. I've seen it so many times in my own practice that we can answer these questions and we can solve these problems for our patients. I hope we haven't stepped on any toes today. We certainly didn't do it out of any sense of intent or uh, we certainly didn't want to do that. But by the same token, so that we don't end up being frogs that are in a kettle that's getting hotter and hotter, and if we're not careful, it's going to come to a boil and we're going to cook. I do think it's important for people to start thinking about many of these things, and we'll do a lot more clinical as we go forward. And thanks, Andrew, for taking your time to talk to me about these things tonight. I
Well,
really
thank you too.
appreciate
And
it.
honestly, if any of the listeners are like, look, I want more of that, I'm happy to give them more of what we just had because I think this is as important as anything. So
I
um,
agree.
I look forward to the comments and hopefully that'll guide where we go next.
All right. Well, you take care.
Awesome. You too, Dr.
Bye.
Taylor. Thank you. Bye-bye.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.